That what we're looking at is we're doing a conjoined effort with Bulldog Hockey. The young men that you'll be talking to later came to us and approached us about doing this project and wanted to know what part they could be for us. And what we're looking at is new and an opportunity that's wonderful for the community.
Oh, yes.
And we're looking at survivorship, and we're going to start with breast cancer because you can't focus on all the diseases.
No.
We have to start with one and narrow it down. Now, of course, our four top are colorectal, lung, prostate, and breast. But we're going to start with breast. And survivorship means from the day of diagnosis, how to get the most quality out of your life and where you're going with it. And you know, once you're diagnosed, you have treatments, you have doctor's appointments, you have tests, and your life for maybe over a year or more is controlled by what you need to do to treat this breast cancer.
And your family's
and
life.
Your family and everybody else.
Involved. Right.
So survivorship is from that day of diagnosis. But once you're done with treatment, all of a sudden you're thrown into what is my life now? Because everybody came to that crisis when you were facing it, and slowly they fall by the wayside, which is life goes on.
Right.
When you're done with treatment, I often say to patients, don't be surprised if you feel something's missing. You don't have to be there at a certain time. You don't have to have this done. Yes, you're going to come back for checkups. But all that support system you have, the patients that went through treatment with you that were there every day.
They don't understand.
Well, they're gone now.
Yeah.
You saw them every day. You had a support system. You had a friendship. And now you're back to your life. And what's normal?
Right.
What is that?
How do you redefine normal after that?
And where do you go with it?
Right.
You know, there may be health issues. There may be long-term side effects from treatment, chemo or radiation. There could be financial issues you're looking at and getting back into whatever you were doing before. And maybe some of that's changed. And especially for women, whether you've had a lumpectomy or mastectomy, whether you've had reconstruction or not, I always liken it to, you know, you saw that accident, but you took your car and it was fixed. So it looks normal again. But for a patient that has gone through this, every morning when they get up, they're looking at that accident. It's healed, it's gone on, but you're still seeing the crisis that was there when it was diagnosed.
And it makes you a different person inside. It has to.
Absolutely. You look at life differently. You have different priorities than you had before. And I know even for myself, having been a breast cancer survivor and continuing, that I really don't like negative people. You know, I want to look at positive and look at the bright side of things and enjoy each moment, which it shouldn't take a disease process to make you do that.
But it makes you reevaluate what's important to you.
Right. Well, and what we're looking at in this survivorship program is these women and men, because men can get breast cancer, so if you see a pink and blue ribbon, that's because you've got men and women as well.
Right.
But what we're looking at is how to get them through this next part of it. You know, we want healthy lifestyles. We don't, no matter what you do, in your mind, you have a fear of recurrence.
Sure.
You have issues that you have to resolve and figure out. Maybe you didn't have reconstruction right then, but 5 years down the road, you go, you know, I just can't wear clothes right, or for my own self-esteem, I need to do something. And we try to work with the providers, their primary providers, and have a plan to help them along this way. Maybe it's time they have something else checked, or, you know, I have a question. Is this something critical, or is this normal? You know, I often hear from women that have had this surgery, they get a twang in their surgical area, and they go, oh my gosh, what is it?
That scares them.
It's nerves.
Sure.
It's nerves regenerating. But if you don't know that, you're going, is it more? Is it something that I should be concerned about?
Yes.
So we're looking at survivorship because we have so many people out in our community that are now lost to a system that is effective but not effective enough. These people can be lone islands out there because now the husband's working, it's not focused on you, the kids are back to school or wherever you're at.
It's not on purpose. I mean, you don't.
Life goes on.
Life goes on, but this is a way of approaching that facet of kind of survivorship, recovery.
Right, and get them to a healthy lifestyle where they enjoy. And they're not so focused on main issues that may or may not be there, but also the fact that there are concerns we need to address. You can't just sit and wait. You know, how many times have I heard somebody say, well, I found a lump, and I've waited 3 years. And so we don't want a patient that's been through it already to sit back and go, be non-complacent either. So we have to be proactive and help teach this healthy lifestyle, be a support system for them, and have a great survivorship.
Okay, so you've got all this you want to do.
Yes.
And somebody approached you with an idea.
Well, they came and said, what are your needs? And said, we sat down and said, this is where we want to go.
Okay.
This is what we're looking at. And we want to get this program off on its feet. Eventually, you know, how long this is going to take, where we're going to go, and how to develop it. This is all new in the breast cancer area. So this is new, innovative, and I think it's wonderful for our patient.
I do too.
And once we get that established, then we can start looking at the other cancers as well. But let's do it right.
Well, this
and
is
move
a great
forward.
way to test the
Absolutely.
program.
And these gentlemen, young men, I'm just thrilled that they're wanting to be an active part of this. They are coming out to the Oncology Institute September 8th and getting a full tour.
Oh, good.
And so we can show them the linear accelerator. We can show them that this is not a hospital environment.
It sure isn't. I know that. I love it out there.
It's a home atmosphere. There's a family here. And, you know, just to backtrack for 2 seconds, when I went through my treatment, this wasn't here.
It wasn't here.
So you were talking a drive of at least an hour and a half. And if you're talking radiation, you're talking over 30 treatments every day, back and forth.
Oh, my gosh.
So the convenience of having it here and having the medical team we have is phenomenal.
Yes.
So I'm thrilled that they're wanting to support our local community. The funds are coming to the local community and will help those people in need.
Okay, so this is a fundraising effort they're going to be talking in more detail about.
Right.
And it's going to go towards the survivorship program.
For the breast cancer survivorship.
I should make that clear, because you want to start there.
Right.
And you're going to head that up?
I'm going to be a very active participant in it, of course.
But you'll have support staff and other people
we're working
involved.
on it. We're building the whole program.
You're already doing that.
Yeah.
That's good.
So.
I think that it could only be beneficial for those young men, for any young people to come and visit. I mean, isn't it true? Your patients finish their treatments and they just keep coming back because
we have
they just like it there.
Yes, we have many people that have finished their treatment and they've developed such a family community in there that they come back and see us all the time.
I think that's wonderful.
Well, it's awesome.
Yes.
It's awesome because it's nice to know that you're making a difference too, that you're helping.
All right.
So,
All right. Well, listen, is there anything else you wanted to tell us about the program itself, or you wanted to mention about what's coming up with this special event? You want to let the guys do that?
I'm going to let the young men do it because really it's their ball, and I'm so proud of the fact they're going to be our ambassadors.
Okay. All right. Now, this is Sue Kilburn here today. Thank you so much for joining us. You always have a wealth of knowledge, and your compassion is just incredible. It's always a pleasure to talk with you. And I'm glad you could get here from Yolanda G. Barco Oncology Institute today. That's a mouthful for me.
Yes, it is. Thank you so much.
I'm glad you could be here.
I appreciate the time.
Stick with us. Welcome back. I've got some really very nice young men with me today. I'm going to let them introduce themselves because they're involved in some special projects that we just talked to Sue Kilburn about. Now, gentlemen, don't be afraid to speak up. You look very nice today, and we want all the young ladies out there to see you because you are on TV, okay? And your name is?
I'm Cade Nickerson.
And I'm Rob Stainbrook.
All right. Now, you guys are here to tell me about the program that you are doing for your senior project. You're both seniors at MASH, right? Okay. You want to take the ball this time? Or the puck, maybe I should say, the puck. Okay, go ahead.
It's the Power Play Partnership is kind of a shift from the Power Play for Prevention program that we used to do annually.
Yes, I heard about that.
And that program started in 2005 when our coach kind of picked it up from his old college, Cornell University. And he said, wow, this is a great program, and he brought it back to Meadville and got it all started up. And
been doing it for a long time then.
Yeah, long time. But this is
you're
kind of
changing it. You're changing it now.
That's what this year's all about. Is, we wanted to help out more locally with the amazing Oncology Institute.
Yeah, they do a good job out there. You probably heard Sue was talking about what she wants to do with any funds that you raise, and I'm sure you will do very well. So what exactly, let's give you a chance to talk, what exactly is the events that you're going to use to fundraise? Because I'm noticing that there's some really cool props in the back. You know, like I'm liking this, so I want to know more about it.
The game that is going to be coming up is called Think Pink at the Rink.
Think Pink at the rink. Oh, so I see you got your ties on. You got your blue and pink because both men and women. And you got your pink on for the women.
I do.
All right, that shows respect. I like that in my young men. Okay, now go right ahead.
This game is going to be on October 1st at 7:30 against Katanning.
Okay.
And we have been selling tickets up to this game, $5 a piece. And if anybody wants a ticket, they can contact Kate and I to get tickets.
All right.
And it's a chance to get drawn for for the fantasy shot, which is behind us here, to win that car actually, and all the money that is from the tickets gets donated to the Oncology Center.
Okay, so like who donated this car?
Griffin Motors.
Griffin Motors donated this car. Did you guys talk to them about that? Did you approach them about that?
That's how we got it all
They
started.
are very, very supportive of a lot of things in this community, so that's fantastic.
Yep, we're really excited about it.
I'm not the smartest when it comes to hockey because my boys didn't actually play for very long. It was just a short time when they were little. So can you tell me what a fantasy shot is and what that means exactly?
Well, it's just on this board behind here. There's just an opening just big enough for the puck, and I think
like that.
Just puck size.
Yeah, puck size.
Just the width, and I think it's from the blue line. Is that right? You have to shoot it from there.
Okay.
And if you make it, it's
now anybody can take a chance at this.
It's if you get your name drawn from the tickets that you put in.
The only stipulation is you have to be over 21 or over, and you can't have played college hockey or any kind of professional or amateur hockey for 3 years or 4 years.
So you guys can't take a chance.
No.
You're too young and you have too much
Unfortunately,
experience.
we can't win that nice car.
Well, I can understand that. Okay, so people pay for a chance at that. And then isn't there a second part to the program? Isn't there a pledging as well?
You have the pledge card with you right there.
Right there.
And what happens is for every goal, power play goal that we score during our season, people pledge to donate a certain amount of dollars for each goal. So if someone pledges $2 a goal and we have 50 goals, they'll send us a check for $100. So.
Okay, so you've done that in the past, right?
Yeah, that was part of the old program that we carried over.
Okay, okay. And how did you guys do when you guys do that? Like, how much did you make whenever you did that?
The average from 2009, I believe, is like 42 goals per season. So
you could make a lot of money if
we
a lot of people pledge. Do you hear that?
That's the idea.
That's great.
Okay.
So have you ever seen anybody, like, do you think you could actually shoot a puck through that little tiny...
I'd say it's all about luck.
I guess it's a luck shot,
I might have to take a try.
I think anyone can do it.
But you don't get to practice.
I know.
No.